So basically, Medicaid covers, TennCare covers people who are in categories, and maybe just to go, like, what are the categories? If you're a child, you have to be very poor and you have to fit into one of these categories. So those categories are children, elderly, people with disabilities, and they have to be very severe disabilities, or parents of young children. And so, as you were talking about, once the children become adults, then they're not eligible. So childless adults is the main category of people who are falling through the cracks without the Medicaid expansion. And each of those categories have different income levels, but and some of them have resource requirements. But basically, if you're a childless adult and you make less than $1,000 a month, you're going to be without coverage. Even if you have cancer, even if you have zero income, you'll be without coverage until the governor decides that he needs to expand Medicaid or get real on the Tennessee plan.
And I will pass this along to those perhaps more professionally suited to answer the question, but I can address it from a personal standpoint. I'd mentioned that I have a couple of conditions that aren't particularly unusual. Chronic sleep apnea is one, and it's increasingly commonly diagnosed in our culture. The way in which that I had to ensure, as I waded through the number and complexities of plans available to me, that treatment would be available to me for chronic sleep apnea, for which I was denied coverage over a period of years multiple times, was to look very, very carefully into what the plans cover. Now, what's in the marketplace are general synopses of plans, and they will refer you generally by a link to the carrier's website. And then you have to, or I at least, had to go into that website and wade through often a plethora of complex links to try and find out whether a particular condition is one covered, and whether the treatments for which my healthcare providers were recommending that I had been paying cash out of pocket for, whether those treatments would be available under that plan. That really is one reason. The complexity of that process is why I just delayed and delayed and delayed purchasing coverage once I was registered, because I just couldn't simply get the answers. Now, that was just my personal experience. Others can address it on a broader basis.
So I hear this almost every day when I'm enrolling people. It's this or that very particular condition. I do follow the process that John mentioned a lot of times of scrolling through and looking at different conditions. Also, though, I'll just give Jarvis a quick shout out here. I call Jarvis about all kinds of stuff. Things you would never want to know even exist in the human body. I have called him and said, hey, we're looking at a Blue Cross plan. What's the deal with this for this or that? If he doesn't, he's excellent at returning calls promptly, and if he doesn't know the answer, he'll find out and get back to you. But I a lot of times start with, okay, well, what plan are you looking at? What's the company that you're looking at? And then if we can't find it relatively quickly, scrolling through all the pages of information, I will a lot of times also pick up the phone and call a broker, an agent or a broker or someone in billing there. Some of the companies are a lot better than others. There are a couple that are really good and a couple that are not as awesome. But Jarvis is great, and I would use him as a resource if someone is considering a Blue Cross plan.
Really, when it boils down to your insurance, especially when trying to figure out what your benefits are going to cover, there's a couple of things you need to know. First off, when you go through healthcare.gov, John is absolutely right. The information there is generic. You're going to get basically just the basic information about the plan layouts and what's designed. A lot of times on the website, when you actually look at the plan, what it will ask you to see is if you want to go to the carrier's website. Now, if you do choose Blue Cross, I'm not telling you to choose Blue Cross, but if you do go to BCBST, our website is www.bcbst.com. What you can do on our website is pull up the plan itself and the plan design. Our website is basically only going to give you a layout of the way the plan is designed, but it's also going to give you, if you continue to scroll down to look at that plan, what's called a summary of benefit of coverage. Now, the summary of benefit of coverage is a requirement for any insurance company that's out there to give you basically a 7 to 8 page layout of what the benefits are going to cover, and it's going to tell you basically what those benefits are going to cover on a pretty applicable basis, where you should understand what it is that your benefits are offering. Now, when you start to talk about complexities of insurance, and I brought one here, what you get when you sign up with us is called an evidence of coverage. What the evidence of coverage basically is it gives you a layout of every single detail that is involved when it comes to speaking about your insurance. That evidence of coverage will tell you everything from durable medical equipment to what office visits are going to be covered and what exclusions are on your policy. If you really are lost in the intricacies of the policy and you really just don't know how to look that up, or you're just confused about, what does it mean? I'm going to give you this number. It's called 888-257-0996. Now that number is specifically there for individuals who are going through the marketplace to see what the complexities are, if they have any situations as far as wondering, if this or that is going to be covered, how is it going to be covered on this policy. They can basically tell you what the layout is of that.
So if a person makes over $1,000 a month, that means basically that you can get on healthcare.gov, and then you have 4 kind of big categories of coverage, depending on how much you want to pay. And one really hopeful thing is we have the lowest premiums, second lowest premiums in the nation. And so many of my clients who are privately insured are paying half to a third of what they were paying on the individual market before. So if people are nervous that if they get on, they're not going to be able to afford coverage, right now people are astonished at how cheap plans are. But those 4 categories, what's important is within each category, there's different things, like one of them might have higher co-payments, one of them may have higher out-of-pocket limits. And so really sitting down with somebody who is used to dealing with complex systems and can kind of just ask the person, what do you think that you're going to need, and then figuring out based on that, what works better. So for some people, their main thing they're going to use the coverage for is medicine, so they want to have lower co-payments. But if their main thing they're going to be using the coverage for is hospital stays or doctor visits, then it's kind of a different plan within those 4 categories. And so even though really anybody can do this who has a computer, I find that just what you were saying, because it's your life and because the overwhelming nature of what your choices are can be just really hard. Just sitting down with somebody to ask the questions, what am I going to need healthcare for in the next year, is super helpful. You can do on the healthcare.gov website a comparison between plans, but still it's just a little bit overwhelming.